George Dwyer, from Rockaway, New Jersey, and we've spent the last 14 months here in Chicago so that my wife could get a double lung transplant. And the reason that we came to Chicago for that was because it turned out besides pulmonary fibrosis, she also had a comorbidity of lung cancer. Well, it began the summer prior when we found out that she had lung cancer in addition to the pulmonary fibrosis. So back in New Jersey, she had chemotherapy there that lasted from the middle of July to the day after Thanksgiving. It was 5 rounds. Each round lasted 3 weeks. And we kept going through it. And at first it was very difficult because she had a reaction. And then they changed and tweaked the medication a little bit to where she tolerated it much better. But it was painful for her to go through a little bit. But we needed to do that in order to come here and be part of the Dream State. Fabulous. They are the best people. I think it was totally necessary. But if she didn't have the support from me and also from other family members, it would have been too difficult of a journey. You couldn't do it as an individual. You need a team. Every time I spoke to them, they just let us know what was going on and what to look forward to happening. And we had such great outcomes. We did hit speed bumps along the way, but they were just speed bumps, nothing that we couldn't bypass. There was one time when she was in the hospital, and we didn't realize it, but they came in and they told us that the nurse told us that they were going to make arrangements for her to have chemotherapy, and we were kind of a little blindsided by that. We didn't realize that was going to take place, but then Dr. Shea came and explained to us that it was necessary to be a little proactive. Not that they had found any cancer post-transplant, but there was some signs in the thyroid lymph node, and they wanted to make sure that if there was any cancer cells there, that they couldn't replicate and turn into a cancer tumor. So we were a little, we didn't realize that was part of the plan, but then it was explained to us, and we were fine with it. Maybe when we left step down, and Jeanne got to ring the bell. That was very encouraging. And she spent two times also at Shirley Ryan. So every time we left a stay in the hospital or at rehab, it was very encouraging to see that. No, I was very confident with the care we were given here and how the team always had a plan. And of course we were dealing with thoracic, we were dealing with transplant, and we were dealing with oncology and pulmonology. And all those pieces came together and worked as one. So I felt very confident that we were in the right place. You should always have hope, and you should, and don't always accept sometimes what you're being told. Jeanne had been told by doctors in New York and in New Jersey that she should not get a lung transplant because the cancer that was in her body was just going to spread rapidly throughout her body, and she wouldn't survive. She might not even survive the surgery itself. And we found out about Northwestern, and we reached out, and it gave us a second chance when we thought we had no further options. It gave us life again. I would say, like the doctors that we met in New York, don't just go by the book, because sometimes the book needs to be written, like they've done here at Northwestern. They've rewritten the transplant book for patients. Also, don't give up hope. Always, think positive. Positive thoughts help in your healing. Because there were many times where I would say a prayer, and that things would continue to go well, or maybe when we hit a little road bump to help us get over the little road bump, and it was also prayers from so many other people. Everyone that I spoke with, and would call and want to know about Jeanne's progress. They would always say that they were saying prayers for her. Mostly, especially when she was in the ICU, because when they had the surgery on Tuesday, they didn't close the incision until Friday. So she was in the ICU with it open, and that was scary because they said it does happen. Don't it's not unusual, but it's not the usual one, but it's not something they weren't prepared to deal with. But that was at times that was a little sketchy, but we did manage to get through it, and they even got to show me through the gauze I could see her heart beating, and that was pretty amazing.